Hello, everyone. I want to welcome you to Let's Chat. I'm Dr. Diana Bitner of True Women's Health, and in a second, I'll introduce my partner and co-founder, Allyn Lebster. I'm so excited about this because True has been a dream come true, and I am so lucky to get to do what I love to do every day. And I'm here tonight to talk about the year that we've gone through and the year ahead with my business partner and co-founder, Allyn Lebster. Allyn, I am so blessed with our friendship and our partnership, and I couldn't do this without you. So why do you care about this? I know this is your favorite thing to come on media, but I just so appreciate it, and here we are.
Yeah, like you, Diana, I'm just so excited and so pleased that we've pulled this off in the year that we've had. Our long business relationship and our friendship has just been amazing, and I'm so excited to do this Let's Chat because I love to talk about what we do at True. I think that not only do I love hearing patient stories, but I love our fantastic team. Our team is just innovative and professional and fun and patient focused, and I just love what we do. So I'm excited to talk about that tonight.
Very cool. And I reflect a little bit on our relationship. We met back in the day. I had this dream of True and women's health, and you were an early believer and encouraged me to keep going. And it's pretty surreal that we're here today talking about this. The clinic's been open, a year now? What was our first day? I can't remember.
Our first day in the office was June the 6th, but we started telehealth last May. So exactly 1 year.
It's cool. And I think a good way to sum up our relationship is we both dream, but then you make it happen. So keep us all pointed in the right direction. So I'm very grateful. So in talking about what's happened in the last year, when I started to make this list, I was blown away really at how much we've accomplished. You and me, our personalities is we want to do more, we want to do better, but we really have done a lot. And the first thing is we had to deal with construction delays, right? We wanted to get the clinic up and running. We were ready to go. And of course, this pandemic started. So it was a challenge. But we worked well with the company and we just took a deep breath. And that's what made us get our telehealth going.
Yes, everyone should open a business during a global pandemic. I highly recommend it. So we did get delayed on our construction due to COVID, but First Companies was there. Other than COVID, we were on time, on budget. We opened with this fabulous space. Like I said, the 1st of June, our space is lovely, and we were able to start with telehealth in May, even though we couldn't physically open. And so you and I, we just pivoted. We got our mobile app up and running, and we're able to do the telehealth visits in May. So our patients really appreciated that.
Yeah, and I think developing our app is HIPAA compliant, and I think we first had the idea. Well, really, the idea got mature for the app in December. We went to New York and we met with a company and they had it written and we were ready to go when we had construction delays. So our app has been just such a blessing. We do telehealth on our app. We're able to communicate with patients. I think that's been one of the biggest drivers of patients being so happy is that they don't have to be on hold at the office. They don't have to leave a message and wait to hear back. They just text us 24/7 and we're able to answer them back. So I know you've heard stories about that as well as they can fill out all their intake forms. So we know our patients before they even walk in the door by all the information they share with us on the app. So the app's I'm very proud of the app. I talk to other colleagues across the country and they really talk about that app as being a huge thing.
Yeah, and you mentioned that chat feature. And so the first thing our team does every morning is get in that app and look at the chat and problem solve among the team on who's going to answer which call. I guess you answer most at night if they're urgent, but then the team just jumps on that. And so I think in hiring our team, a big thing that we looked for was somebody that was flexible, somebody that was innovative, somebody that was not afraid of technology. And so our team, between Elizabeth and Jill and Amy and Nancy, they are all over that app and corresponding with patients. And so that's just a huge factor in patient satisfaction, I think.
Yeah, and the app is fun because at night I'll talk to patients about, yes, we'll follow up and get that task, yes, but in the night I might not do that. So the team checks it every morning and they follow up on all the conversations I've had with patients the night before. So we make sure right away in the morning, that stuff is done. And I love it when I answer a patient back, she'll be like, what are you doing working at 8 o'clock at night? This was not meant for you to answer, but it's just what we do. We get to practice medicine the way we want. So that's very exciting. And you were talking about this great team. On top of that, we, introduced these new concepts. So our team got to learn all about waypoints and picture of self, but, also it's been my dream to really use this method with patients in terms of goal setting. So every time a patient comes in, we say, what do you want? What is your goal? What is your picture of self? And we want to help you get there. So we've introduced these concepts, these ways of looking at women's health to patients. And between our team and our patients, it's now just become the language of true. Seeing a patient yesterday, she was like, yep, I did. I had a night sweat, and what did I do right away? I went through my seeds, and I thought, oh, I didn't drink my water. Oh, I had sugar. Oh, so people are using these tools in their day-to-day life, and it makes me very happy.
Yeah, and what I enjoy too is because I'm at the front of the office, so people go by my office after their appointment, and the comments I hear are just, wow, like I did not expect my appointment to be that. The picture of self, the things that our providers talk about in the office, patients are just blown away as they're leaving. And so that's really satisfying to hear as well.
No, it's good. So I'm looking at my list. I don't want to forget anything. Oh, I remember one thing early on when we did some focus groups with patients, they said, well, I love the care I'm getting. What about my daughter? What about my mother? So we took that and we started the Empower program. So this is for patients who maybe don't want the regular membership. They only maybe really want that one visit and they're 25 and under. We started the Empower program, and these patients come in and we talk about sexual health and family planning or birth control. We'll put in IUDs. We talk about irregular heavy periods, talk about mood and coping. That's what's been lovely. And also the Silver Wellness program is for women who are 65 and over. We don't participate with Medicare, and so we wanted a one-time visit for women 65 and over to come in for that one-time consultation to kind of make sure everything's in order for the next year. So those programs have been very successful. And again, they came out of patient focus groups of patients asking for this.
And those Empower visits are so important for young women to learn about healthy sex, family planning, the things that, like I know for my own personal experience, you have an 18-year-old who's been with their pediatrician since they were born. They don't really feel comfortable about talking to about sex with that pediatrician that's been with them since they were little. And so I think that Empower visit's really important for that.
It's great. And sometimes young women will come in and they're like, my mom made me come, like, you're not going to do a pelvic, are you? And then by the end of the visit, they're like, when can I come back? This was so fun. I learned so much. So I really enjoy all the visits, but I really enjoy those visits to see how they just open up. So it's great.
Yeah, and I think one of our other programs that we started this year that's been very successful, and again, I love hearing the patient stories, is our cancer wellness program. And with Suzanne and her background and her specialty in cancer survivorship, that's really been a fun program to watch develop as well.
Yeah, and if people have questions, Joy is one of our patients who did a testimonial on our website. So if you go to the truewomenshealth.com website, Joy does a nice talk about her experience, and it makes me teary every time because she really thought, what next and how am I going to get through the next 50 years after having gone through treatment. And we were able to get her feeling better. And she actually had the Mona Lisa touch, which she talks about in public, so I can say that, but she had the Mona Lisa and it really made a difference for her. So that's been exciting.
Yeah, and that Mona Lisa, I just hear patients again just say it's life-changing. I can think of one patient who had a very active sex life pre-cancer, and then she had some cancer. She had 2 bouts of cancer, and it really affected her relationship. And after she came and you did some treatments, she just said it was just life-changing. It saved their marriage. It saved her life.
Which is it's pretty cool. It's pretty amazing. And everyone too, we want to keep this casual. So if you have questions, please put them in the chat bar. I'm watching it, and so is Missy behind the scenes. So just feel free to interrupt with any questions. I want to talk a little bit about Suzanne. Suzanne is our PA who has done primary care for 30 years, specialized in cancer wellness, and then now is studying with Aviva Ram, a Yale-trained internist, the mother of functional medicine. And Suzanne is studying for her certificate in functional medicine. And we're all learning from her coursework. She comes in so excited, like she's like, I totally get thyroid, or about gut health and about different aspects of supplements and bone health. And so I so look forward to all of you getting to meet her. Hi, Angie, how are you? And so it's really exciting to talk about this functional medicine, because we really want to look at people as a whole. And so, perhaps certain things in traditional medicine aren't working, or you've got irritable bowel and nobody can figure it out. Please give us a crack at it. We love to help people feel better with really holistic type care and different options.
Yeah, and talk about that whole person. Adding Ashley and doing the mental health counseling has been amazing. It's so cool to have her in the office. I did not imagine when we started 1 year ago we'd already need a counselor in the office, but she started and now she's expanded her hours, and so that's been really nice to see. She's a really good relationship with so many patients.
Well, and I'm just so proud again of our team, like you mentioned. Like, we were very intentional about who we hired, and everyone's a self-starter and really believes in the true model. And Ashley just naturally joined the team. And what I love about Ashley is she's so centered and so calm and so normal. And I've had so many patients say to me, like, I've seen lots of therapists, she's like the best. So that always makes me feel so good. And so Ashley, if you're listening, thank you. You're awesome, and keep up the good work. So it's been a blessing.
Yeah, and of course we can't mention our team without mentioning Ashley. Anna. And Anna's just amazing, and I love how she's grown and worked with patients and is studying to become an RD, and she's just amazing. So
I had a patient who wasn't so sure if she wanted to see Anna, because she's like, I'm a foodie, I feel like I already know a lot. And Anna is a Culinary Institute trained chef, and she met with this patient and her husband at home. He's the cook in the family. And they said it was amazing. They've already switched from white rice to this brown rice mix, like all these little things to get healthier things into their diet. They said it was a fantastic visit. And Anna's already followed up with them, given more menus and shopping lists. So it's really made a difference in their day-to-day life. So again, that's certainly an honor.
It was super cool to do those cooking with Anna on our private patient Facebooks. I think that was really neat this year.
Yeah, and I look forward to many more of those. And speaking of Facebook, we've had lots of great Let's Chats with collaborators, such as Mitch at Grip Gym. We've had over 2,000 views of that conversation. We've had conversations with, I don't want to forget about the Mona Lisa touch with Dr. Maria Sophocles. She brought it to the US from Italy. And we've had her on, Dr. James Simon, talking about how hormones are safe, more safe than most people think. Vonnie Woodrick about I Understand, Amy Chambers about the finances of healthcare, Tammy Myers, who is a breast cancer survivor and just had twins and has another daughter. And so Tammy's doing great and was able to share her story. And Dr. Laura Kelsey about veins and vein health. That's gotten lots of views. So, we look forward to more collaboration in the future, but it's been really great to introduce to our patients who I really trust to send them to. And so we look forward to more collaboration with the Center for Plastic Surgery, with Bankston Surgery, with iMove Physical Therapy. Hopefully soon we'll have even a stronger collaboration with them. And again, when I send my patient to a specialist, I want to know that the patient's going to have a good experience, and that it's safe and the options I would agree with, and all of that, to know that we're going to kind of follow along with them, not just send them off and hope for the best. We're sending them to a trusted partner or collaborator, and we know that they're going to get good care. I get notes from patients all the time like, oh, I'm so happy with who you had me see. So that's been great. We want to bring them on. And yes, Joy, thanks for mentioning that. But yeah, we love the total collaboration. So looking ahead, do you want to talk about that? And then we can move into our 5 tips. I mean, we could talk about this all night, but let's talk about looking ahead.
Yeah, I think the biggest news in the coming month is the fact that we're going to be participating with most major insurances. And so that is a big change, and that is really based on patient feedback. We heard from a lot of patients that they wanted us to participate with insurance. We are stacked and ready for next month for ASR, for Aetna, for Priority Health and Cigna and United Healthcare. And we are pretty far into the credentialing process for the Blues. So hopefully that comes in the next few months as well. The Blues are just always a little slower, but we will be participating with those insurances. And then what we're also going to do is we're going to be courtesy billing for insurances that we don't participate with. And so that's really a nice service for patients. They won't have to take their form and submit their form for reimbursement. And so we're putting a new system in for next month. And so we'll be submitting claims for patients, whether we participate or not with their insurances. So that's the big news. And second to that is the fact that we will also be able to be a primary care provider or PCP with participating with those insurances. So that's also big news.
And to your point, many people have said this was a barrier. It's just too new of a concept to have a membership-based practice only. Like, what does that mean? I want to be able to use my insurance. It's just, a pain to submit. And so, it's been a bit of a project. I mean, Allyn, thank you. You've done the most of this work on this, but we really feel like this is the best way to serve our patients, and we'll figure it out. Now, we'll still have our membership fees because we do so much on top of what insurance would cover. And so to provide the care we need to provide the true experience, we're still offering our care with a membership fee. So for people who choose the complete program, you get to have us be your primary care with your insurance, because that's the type of care we give. This is not problem-based care where you just have a problem and we deal with it. You get high blood pressure, high cholesterol medicine. No, we want to prevent the high blood pressure. We want to prevent the heart disease. And so our whole team together will do that. So we've got me in the lane of menopause and sexual health and GYN, and as we call it, Ladytown. We've got Suzanne with primary care and functional medicine, cancer wellness, and now we have Dr. Egan. So that's the other big news. We're so excited to announce the joining of Dr. Celia Egan. Dr. Egan is a primary care doctor and a very brilliant. There is her picture. She is a trained internist, trained on the East Coast, and worked at NYU. And she's originally from West Michigan, so she's local, born and raised. And she's just lovely. And so as she joins True, her first day is August 16th. Her first several days are already full. People have reserved her first appointments. And the other thing about Dr. Egan is she is board certified in obesity medicine. Think about it as metabolic health. And so I feel like I know a lot about insulin and diabetes. You all know I talk about it a lot. She knows 20 times more. And so we'll be full service. We'll have an EKG machine right in the office and really be providing that concierge level at a very approachable way of primary care medicine.
Yeah, so in addition to being a PCP, a female internist who's open and who you can actually get an appointment with, those are keys. She's also going to be launching that True Weight Journey. And we're going to have 3 different programs within that weight journey. So the first is a 12-week intense program with a very low calorie diet. That's called our Ultimate program. The second is called our Fresh Start program. And that's a 6-month program that still is a medically guided journey. It's still a physician oversight, but it's a little less intense than the 12 weeks. You'll come in once a month for that 6-month journey. And then the third journey is called Motivate. And that's really an annual program for those on obesity medicines for which they must be under the guidance of a physician. And so Dr. Egan is well-versed in those medicines. She is boarded in obesity medicine. I think she's only one of 3 in all of West Michigan. So we're really, really blessed to have her in West Michigan. We're even luckier to have her at True Women's Health. So very excited about Dr. Egan and our weight journey.
Yeah. And, a lot of times, again, you've all heard me say too, I want to stay in my lane in terms of prescribing or recommending things that I'm very comfortable with. And, people would ask me about medications for weight loss, and it's just, I don't specialize in that. I'm not comfortable prescribing, but I know it's a big request and a big need. And there's a lot of people who have just, because of barriers, because they had a hip replacement and they gained 30 pounds, or for whatever reason, they've had a large weight gain if it was untreated menopause for 5 years. And now they really want to get their life back and want to get that 30, 40, 50 pounds off, but don't want to have surgery. Dr. Egan offers all those options. And what's so cool is we met serendipitously and just hit it off. And she loves the Waypoints program. So we'll be using all of our format, our language, our conversations, the same type of materials, but then geared toward that weight loss journey. So again, it's just, it's going to be awesome. And I can't wait till you all meet her, which leads me into another thing going forward is, we've always wanted to have smaller in-person groups. And so we'll be able to have smaller group classes. Of course, we've learned telehealth and we've learned how to, have things on the World Wide Web with a Facebook. So we'll be having those in person and we'll be able to transmit them at the same time, but more cooking classes, groups on functional health, on bowel health, on thyroid. We really look forward to providing more and more value for those who trust us with their care to add on even past a visit. Our first visit with patients is an hour long, but that even goes so fast. And, the follow-up appointments at 30 minutes, again, that's a lot of time, but yet there's still those smaller details. And so we really want to provide those and fill in the cracks with all these other bits of content.
And that's one point too, when you said that appointment is 1 hour long, I want to re-emphasize that just because we're participating with insurance it's not going to change the way that we practice medicine or you practice medicine. We're still going to have those in-depth appointments. We're still going to focus on what the patient wants us to focus on, not what an insurance company wants us to focus on. And so even though we're participating with insurance, it's really still going to be that same high level of care and deep dive.
Yeah, we've had questions about that. They're like, if you're going to take insurance, are you going back to the 10-minute visits? We're like, no. Yeah. And again, so, it's doing all that extra stuff with our app and with our team and with those extra visits. So yeah, we're definitely keeping the true level of care, but just adding that again to get over the barriers that it created for some people. What else are we forgetting going forward? We're expanding our reach with a cancer wellness program. So looking forward to collaboration in West Michigan with other providers the oncologists at different systems. We're looking to see how we can collaborate more and even looking to do breast cancer screening for larger employers that want us to look at that for their employees. If we can catch breast cancer early, we can not only reduce cost, but we can reduce the treatment people have to go through. We reduce the side effects of treatment afterwards. If we can catch it where someone can have a mastectomy or have treatment before it spreads, it changes their entire life. So we want to look at screening. We offer genetic testing at the office. And so even if someone has questions about high risk, we have them see Suzanne and we go through a whole risk screening protocol. And then again, like I said, we're able to offer genetic testing and then a plan of what to do with that information.
Yeah, this last year has been amazing. I know the next one's going to be even better. It just is going.
Oh, and two, I wanted to talk about building our community. I've always wanted to offer a Tai Chi class, especially for people who are afraid of falling, who have osteoporosis and really want to work on their balance, but they don't want to do a boot camp type class. Tai Chi is wonderful in terms of building balance, helping people not be afraid of falling, building strength in a very slow motion way that allows you to center and be calm. And Denise Carson has started teaching our Tai Chi class on our South Lawn with Suzanne and Nancy out there with them. And in inclement weather, they can come on the inside to our lobby area. And so I'm really excited to finally have that Tai Chi class. So we're looking to do more classes going forward with meditation, with yoga.
So many more.
Yes, many more to come. So I look forward to that. So again, we so look forward to offering these office hours as well on Facebook, our private page, to have question and answers with myself, with Dr. Egan, with Suzanne. So again, looking forward to that. So, with that, I want to move into our 5 tips. How I always like to leave you with 5 takeaway tips. So tip number 1 is I want you to know that you deserve to age as you want. I love it when patients say, you're right, I want to do what I want, how I want, as long as I want. I don't want to be limited by age or menopause or all these other things. I want to be strong and fit. And together we figure out how to get that for people. I just don't like it when people think, oh, I'm just 60. I'm like, really? you got 40 more years. Let's get you going. So, or even when patients are 80, they're like, yeah, well, I'm 80. I'm like, what are you, 90? Let's get going. So it's, you deserve to age as you want. So Lynn, I think too, you see that, like when we talk to people about that, like they walk out hopeful, like I thought I was stuck feeling like this, right?
For sure, for sure. Age is just a number.
What's that? I'm sorry.
Age is just a number.
Age is just a number. Takeaway tip number 2.
You deserve time with your provider to get your questions answered. So this is my favorite. And again, that's why I reemphasize that we spend time with the patient, and that first appointment is about what the patient wants to focus on. We are not there to drive the appointment. The patient is, and whether it's Suzanne doing a deep dive on gut health, or in the future it'll be Dr. Egan on the weight loss, you guys really spend the time focusing on what the patient wants, and they leave with answers.
Right. And I love it when people bring in lists or they've done research on Dr. Google. I love that, because then it really makes sure that we walk, when they walk out, that they've got their questions answered. And I'll even ask them the first part of the appointment, when you walk out of here, what does success look like? So we make sure we really get to that, and we make a list as we're going, and we make sure we've answered all those questions. I want patients to know why they're feeling what they're feeling. And that time is really what allows us to get into that. Tip number 3, you deserve quick and easy access to your team. I've had patients say, we love that so much that we can text and you answer right away. During the day, the whole team sees the text on the True app. At night, it's myself or Suzanne or Dr. Egan, starting in August, that we see those texts at night. And again, there's quick access. We get right back to you. And again, as we get full, we will cap how many patients we have, because we want to provide this very, it's like I always say, we want to be like the Cheers bar where you walk in, we're like, Norm, exactly. We know our patients, and yes. You deserve that.
And we have all these phones, and they hardly ever ring, because everybody is taken care of through the chat. It's amazing to me.
It's very cool. Tip number 4. You deserve your referrals to be coordinated by your home team. So we're your home team. And Jill keeps track of all the referrals. We want to make sure the referrals are made in a timely way. If not, we're going to call and be your advocate. We want to make sure that you're getting your testing and that you're happy with the appointment. If you choose to have a procedure with a specialist that we refer you to, we'll follow up with that. We'll make sure you're feeling good. We want to coordinate that. And again, we're sending you to people that we trust, and we know you're going to have a good result, and we know you're going to get good evidence-based care. So we want to organize and coordinate that for you. I tell our patients all the time, we want you to feel spoiled. We don't want you to have, to drive that. We want to be your doctor in the family. We want to help organize that for you. And again, this has been a really great thing that our team has embraced this, and we really take good care of this.
For sure.
Yep. And number 5, I know you love this one, Allyn. You had a lot to do with our color scheme and what it looks like. So what do you say about the office?
Yeah, so I think every patient deserves to have an open, comfortable conversation, a calm, comfortable space. We had a dream board with all of the spas that I found online, and I said, this is the look and feel I want, and this is the color scheme. And the lounge chairs in our restorative lounge, I spent a lot of time putting butts in seats trying to figure out the exact perfect lounge chair, and I found it. And I'm so happy we're going to start using it now that COVID is maybe behind us. So our blanket warmer, our leather chairs that are exam table, our lounge chairs, our spa music, even our team's uniform and approach. And it's just a really open environment. Like, you walk in and you feel comfortable, you feel welcome. Elizabeth's there smiling, and she knows everybody by first name, and it's just really that wonderful, comfortable spot.
Yeah, I had a couple of patients actually come early today because they just we just wanted to, come and sit in this comfy chair and have a cup of tea and listen to the spa music. So they came early on purpose, which is just how I imagined it. So again, just a dream come true. And then when we did the exam today, she was like, whoa, wait, this chair actually turns into like, so it's a pretty cool chair with heat and massage. So it's great. So, very happy about that. Again, dream come true. So the next feature I want to go into is our questions that we want you to be able to ask your provider. So I always want to equip you with questions to ask your provider. And so question number 1 is, what is their plan for you to age well? I really want people to be empowered to ask for care beyond problem-based care. So, a lot of times there's screening exams that have to be done for insurance purposes, but what is their plan? And, talk to me about how are you going to help me age well? I want you to ask that question. That's something we feel very strongly about at True. And again, I want you to be empowered to have that with wherever you go, especially if you're out of state and can't see us in person. But I want you to be empowered to ask that. Question number 2. It's about why you're feeling what you're feeling. So this looks a little complicated when I read it, but it's I want you to know why you're feeling, not here's a symptom and here's a prescription, or yeah, you just got to live with that. It's just part of getting older. No, there are reasons why you're feeling what you're feeling, and sometimes just knowing why, then I'm good. I can figure it out. But if you know why you're feeling, Allyn, go ahead.
The other thing, the how to feel better, what I really love about your approach is you say, here are some options to help you feel better, but I'm not going to dictate what you do. So here's 3 different options. And you always say you have no ego invested in what they choose. And so I think that's a very different approach than here's a script, go take this.
Right.
And so you really do a nice job with how to feel better.
Well, thank you again. Golden rule. I want to give patients what I would want. I'm a bossy Dutch girl. I don't want somebody to tell me what to do. Surprise.
I haven't. Oh, you are right. You are.
So seriously, even in our workbook and in our patient journal, there's pages of these are the symptoms, these are the options. And so we give people it's a whole grid of what options offer what, what options offer what relief. And so again, it's right there to see. And if one thing doesn't work or you don't feel comfortable with one option, here's another option that we can introduce to you. So, that's really exciting. And so again, that's we feel very strongly about that. And what I also love again about our team is that I'll talk to a patient about an option, and then when Amy or Jill or Nancy check you out, it's, hey, what questions else do you have about that? Have you thought about something while you're, getting dressed and waiting for me to come in? What other questions do you have? Or if you have any side effects or something doesn't make sense, just give us a chat on the text or give us a call and we can talk through it. So we really want to make sure people are comfortable. Today, I pulled out a package insert of a medicine with the patient. We read the package insert together because I didn't want her to get home and have questions about, wow, I didn't think this was associated with that. So anyways, it's all about informed consent. Tip or question number 4, how can I access you if I have a question? So again, it's all about what I just said. By the text, of course, give a call. If patients give a call, it comes right to my cell phone. So there's direct access through either way, through the text or the number. And again, our team knows all about our medicines. We talk about this all the time, or all our treatment options, or the Mona Lisa touch. I think Amy could probably do a Mona Lisa herself at this point, but she's right in there when we do the Mona Lisa laser. And so it's, again, the whole team is comfortable with what we offer at True and is able to talk to you about it. Question number 4, when you see another provider, I want you to be able to know, how are the referrals coordinated and how do they choose a particular specialist? At True, we're an independent practice. We have the luxury of being able to choose a provider from any one of the systems in our town and in our area, in West Michigan. And so we really can make relationships with providers who provide our patients excellent care. And so it's just when you have referrals offered to you by your primary care, it's to ask, how did you choose that person? Tell me about your experience with that. So again, that's a question I want you to be equipped to ask.
Looks like we have a question from Julie. Are you accepting new patients? Yes, Julie, we are accepting new patients.
We are. We still have room. What's been fun since the announcement of Dr. Egan, the calls have been coming in. So we definitely are filling up for those spots, and her initial schedule is already full. So especially if you want an opportunity to have her be your primary care, we'd love to see you call and get signed up. Check out our website at truewomenshealth.com. I see that's been in the chat room. Thanks, Missy. That truewomenshealth.com goes through all the options. And as we get more information about each of our programs, I know the weight loss journey is up there, but too, you can sign up for information about the weight loss journeys if you're interested in that. We already have a long list on that, and we're keeping people in contact about when they can sign up for that and make an appointment. So yeah, so there's lots of information on the website, and we can't wait to see you. Question number 5. I want you to be able to ask your provider, what do they like about their job? Again, I can't believe every day that I get to go to work at True. I walk in the back, which is as pretty as the front, and I just feel so lucky to be there. On Wednesdays, we have our team meetings in the morning and then our clinical meeting at lunch, and I'm just so lucky. We have so much conversation and debate and learning, and we're constantly trying to make our process better. And again, I just can't believe it. So I want you to be able to ask your provider, are you happy? Do you like what you do? Do you like how you do it? That's just going to give the best result for everybody.
Agreed.
Okay, cool. The other thing I want to bring up is I really want True, as we grow and we expand, more and more the website to be the source of truth. You know, we have so many patients who say, you know, I searched hot flashes on Google and I came up with 20 million different options for treatment. I don't know what applies to me. And so more and more as we are able to build the website and build our content, we really want to be the source of truth, and more to talk about what articles are out there. What's the latest treatment? There was just a treatment approved by the FDA for low libido. It's an on-demand shot called Vyleesi. It's a shot that within 45 minutes, I joke with my patients, you'll be chasing them around the room, or if your partner is female, chasing her around the room. You'll be chasing your partner around the room. And the only downside is that the effect can last up to 12 hours. So be prepared. But it does help with that.
Better have your running shoes on, apparently.
Running shoes. Yeah, my one patient complained. She said, you didn't tell me it would last for 12 hours. My partner was getting a little tired, but it really can help with that spontaneous libido. And again, this is an FDA approved treatment that is safe and effective. So as these new treatments come out, we will have access to them. We will be talking about them. Come fall, Dr. Simon's going to visit West Michigan, and he'll be visiting, and we'll be doing some talks together about sexual health. You know, we'll be bringing experts to town now that people can travel again. We're so excited to really be at the forefront of women's health and be bringing these experts to you so you can ask your questions to, again, world-renowned experts. Suzanne is very involved on the national level with cancer, wellness, menopause, and sexual health. I'm involved on a national level with the North American Menopause Society and the International Society for the Study of Women's Health, and looking forward to getting more involved with the International Menopause Society. So again, the information we provide at True is truly evidence-based and groundbreaking, and you know, at the standard of care. So with that, I can't wait to meet more of you. I can't wait to continue to know our current patients better. Thank you to everyone who's listened tonight. And Allyn, again, I can't thank you enough for you know, being just a huge cheerleader, making everything happen and keep us moving forward. So
we have a good thing going.
We have a good thing going. So this is going to be a great second year, and I can't wait to be here in 12 months and talk about all that we will have accomplished in the next year. So for those of you, again, if insurance has been a barrier, know that we're taking insurance, and information will be on the website. Please check us out at truewomenshealth.com. Thank you, everyone. Stay safe. Have a good night.
Thank you. Good night.